Hi guys, it's been a while since I've done a video. I'm Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington. And we have new, it's kind of funny how people end up finding you, but either through word of mouth or through the internet or other friends or family. She actually came in and she was quite a bit nervous to come in for her treatment. You can see I have her traction right now. I guess the choice of word would be really scared to come into a chiropractor, but after a few visits that we've had together, she's made some really great changes. She's gotten back to some of her running, and she's preparing to join and prepare for one of our armed forces. So congratulations to you, and you know that makes a big difference in people. So I'm just going to explain a little bit of what I'm doing and why I'm doing it. In fact, this would be a really good example. Someone had asked me, what kind of table is this and how, and how is it different than other tables? It produces a traction to the spine, and there's many different ways. It's called the Leander Flexion Distraction Table. So it does a traction of the low back as well as the other portions of the spine. And one of the things that we do in getting that traction or areas to open up is change the height of the table to help open up the back portion where the disc happens to get compressed, as well as pinching the nerves. So the table moves in many different directions in combination. But as I increase some of the stretching, I could fasten the patient down, as well as strap them down from here if they have types of scoliosis. Other times, what I mainly do with patients is when they come in, I like to do a nice gentle traction into their spine where I'm actually holding the back of the head and over by the sacrum. That's the primary area. And does that feel like more traction back there when I do this?
Yes.
Yeah. I'm not pushing your head too much into the table, am I?
No.
No. So people that have any disc issues, pinched nerves, this is a great way to gently ease them into some of the treatments and get their body stretched out before actually adjusting the area of their lower back that may be misaligned down there. And I can increase it a little more, which is what I want to do today. Good. So that'll increase the angle of the stretch in there. And then I like to place my hand right across the scapula or the shoulder blade and the SI joint. So as the table goes down, it gets a little more traction through there. That'll help stretch the long muscles of the back right through here. Not too hard on you?
No.
Good. And then we change our angle with this. Now, she's not in so much of a acute phase anymore, so I don't have to do some of the other styles and techniques, but I will show you one of the techniques that is utilized when people have degeneration of the joints or discs down here by adding gentle pressure onto the back of the vertebrae. So the most common area that'll affect most of us that are standing upright will be that L5-S1, sometimes L4, L5. So I'm going to place my hand right above and right on that L4 right here. So I'm holding that contact right on the spinous, and I can actually, can you feel a deeper stretch there?
Yes.
You okay?
Yes.
And I'm going to go up just one more, and I can feel all her back muscles starting to contract there. So I don't want to go any more than that, especially as it goes down. Sometimes I'll add a little bit more right through here. My hands contact right through the quadratus lumborum. That's that deep muscle of the lower back. You a little tender there?
Yes.
I would suspect so. And along with the traction, when that joint actually stretches and opens up, we can begin adjusting some of that area. So sometimes you'll see on the video where the table's actually moving versus not moving. So breath in and out. So we're aligning the pelvis. Some of the chiropractors place the patient on their sides. I'm adjusting both SI joints and getting the sacrum to shift over there. And especially if people have various amounts of scoliosis or curves in the spine that lean to the left or right, you can see how I can change the angle of the table as well. Sometimes I'll even move it to the side like this, just to see what kind of stretch I get throughout there. It's a lateral bend right through here. Not too much on you?
No, not
And if people want, you know, I mean, depending what's going on and how long I've been treating them, I can even change the angle so I can get even a deeper stretch on them. I'm going to bring this section up. Careful it doesn't pinch you. Okay, and now we're going to bring it down right through here. So now we're going to begin adjusting. I've known, you know, been adjusting. Is this like our 5th time? No,
Yes.
it's about 5. So I got more familiar with her body and how she adjusts. I want you to lay on your right side. We're going to bring this up so it supports your head. Then we're going to bring this to this angle. By doing that, helps open up the back facet of the joints back here. And chiropractors who are using this table can get a little more ease in there by dropping that up. So that actual joint space that's right here in the lower back, you want to come around, Lisa, sits right here. There we go, L4, L5. You probably heard that one. Now you got to see her face. Now she's all smiling. That was a lot of movement, wasn't that?
Yeah.
You were all jacked up. All right, I'm going to have you go the opposite way for me. I put it in the center for you, so I'm going to have you switch, rotate this way. And we're going to bring the table slightly this way here. Bend this. And we're going to bring the arms out like this, crossing here. So that was very easy. You feel that way? Now she's smiling again. So we're right at L5S1, opening up that joint, right where the facets are. Best adjustment so far, isn't it?
Yes.
You're doing awesome, good job. So what happens to people is those areas get restricted. I'm gonna have you lay on your back, and they don't move. So when a chiropractor identifies the misalignment, we adjust that, and that frees up the nerves and the muscles to communicate more to the body. Those nerves are talking to muscles, they're talking to organs in the body. That's the difference it makes in people's lives. And so they have a big legal action going down in Texas and taking away chiropractic, taking away people seeing a chiropractor as a primary healthcare provider. We are primary healthcare providers, just our method tends to be a non-drug method in helping people heal, because the body has that potential when you remove that interference or areas that are misaligned in there. So this is where you were scared before, remember? Now you're fine. We're going to switch spots, Lisa. So I have a new videographer behind the scenes here. That's Lisa. So anyways, let's have you cross your arms right here. We're going to bend the knees, feet on the table, and I'm going to have you move downward for me a little bit more, a little more, a little bit more. There you go. Good. All right. Big breath in. Release that breath out. Lift your head. There it is. That's some good cracking. We try to have fun with what we're doing. Breath in and out. Good. Beautiful.